How much of healthcare will shift to the home, and at what pace do you think that's going to happen?
Yeah, so I don't know. When people talk about hospital at home, the skeptic in me thinks of it as just a different new wave of home health. And it thinks of it as hospitals are very aggressively trying to reduce their length of stay. And this is another way to really move towards that. That's the skeptic in me. The optimist in me says that a patient would much rather be at home for those extra couple days of length of stay. And if there's the right technology, the right care they feel taken care of, and they've got some help, the better off they are. So there's this great mix. We certainly talked to tons of health systems, whether it's Jefferson, Adventist Health in the West Coast, or others, that view the growth of hospital to home as a huge, huge growth opportunity. Adventist talks about they've got 25 hospitals or 24 hospitals. They believe their biggest hospital will be their 26th hospital, which they call their hospital at home. And the beauty of it is, because you live in the technology world, so much of the value in the world, at least in terms of economic value, has moved towards asset light models. So the asset heavy models in terms of industry, the stock market getting killed, the asset light models like the Ubers, the Airbnbs, where they don't own all the assets, they just own the technology, is where the economic value has been because you're not holding all these costs. You're just simply the technology interweaver of all of it. So if hospitals could move themselves to being this technology asset light business where they don't have these $5 billion campuses, and it's not so much the $5 billion cost to build the campus, it's all the constant operating costs of having that kind of bricks and mortar and weight, that will move hospitals more into this world of being able to spend money on technology and people versus bricks and mortar. So there's a lot of incentive to do it, to move in that direction. And it just depends. Again, it's like a lot of things. It depends on the health of the patient itself. Certainly, the more healthy patients would much prefer to be at home than in the hospital. So if you're a pneumonia patient, you're not that sick, you're going to be at home. If you're recovering from surgery and you don't require that much care, you're going to be at home. My father just had a procedure. He could have been in the hospital for 2 days or 5 days. He ended up home after 2 days, but he has support. He's got my mother watching him, and he's got hospital support as well. But so it depends a lot on the health and support systems and so forth as to how far this goes. But
Yeah.
but it's something that everybody's very incented to because hospitals are trying to figure out how do they compete against the rest of the world that's moved towards an asset light model where they're an asset heavy model.